Hi, I'm Avelinda and I'm here to explain what delirium is, its causes, what happens when a person has it, its prevention, and how is it different from dementia. So let's get started. People with delirium often have terrifying hallucinations, delusions, and are unable to think clearly or focus, just like someone suffering from dementia. Delirium is a serious condition that causes a great deal of suffering and affects at least 20% of patients who are already confined in the hospital. Delirium arises when someone is physically unwell and is intensely common to patients with medical conditions such as when these are confined in intensive care with respiratory ventilators or heavily sedated. Patients recovering from surgery, side effects of medication, or those suffering from urinary tract infection may also suffer from delirium. People with delirium have cognitive and memory problems, hallucinations, symptoms of post-traumatic stress disorder or PTSD, or altered consciousness and disorientation. They may appear drowsy and may behave strangely or even become aggressive or become unresponsive to normal stimulus like being asked or talked to. It has been reported that those people who have had traumatic experiences tend to have delusional memories. These memories are most often than not distortions of things that have actually happened. Large doses of anti-anxiety drugs and narcotics are triggers of delirium, while other culprits could be the busy surroundings, noise and harsh lights, constantly interrupted sleep, or those environments where carers, family members, or staff keeps moving around. Unfortunately, once a delirium starts, it can last for months. Patients suffering from delirium have longer hospital stays, greater risk of falls, increased risk of developing dementia, and an increased death rate. However, Dr. Sharon Inouye, a geriatric doctor and Harvard Medical School professor of medicine, says preventing delirium is crucial because there still aren't good treatments for it once it occurs. Being more careful with medication may help prevent delirium to hospitalized seniors. Taking them off breathing machines sooner or getting them to move around and out of bed also are great aids in preventing delirium. Delirium develops gradually and gets worse progressively. In contrast, it is often difficult to indicate when dementia started. Most often than not, it began several months or more than a year before a diagnosis is made. We must advocate for our senior loved ones already confined for the hospital to modify the surroundings to reduce their risk of developing delirium. Hello, I'm with my mother. You're still pretty. Hello. Gusto na ang anak ko maganda. Say bye-bye. Bye-bye. Say bye-bye.
To me.